So my name is Nicole. I'm 44 years of age. I have 5 children. I was on bed rest for basically 2 years, maybe a year and a half to 2 years. I was isolated before isolation became a thing. I've decided to tell my story because I really feel like there is a lack of knowledge and education about this issue. Yeah, I was really getting into life. I'd had weight loss surgery and I was getting out and about and really active with my kids and scouts, and it began, I had an AVM in my bladder where I was bleeding profusely from my urethra. I just kept having complications, and the bleeding was just continuing and it wasn't easing up, and eventually I ended up in intensive care for 7 days. I was in the bed on an air pressure mattress. I had tubes coming out of nearly every orifice, but I could not move until someone physically came in and helped me get out of the bed and get back into the bed. I felt like I was really incapacitated. I just started getting like this itch. Didn't feel as though something had bitten me. It was more just like an aching, a constant aching, and at that point I asked the nurse if I could have a couple of pillows. That was when she asked me what was wrong, and I explained like what I'd been feeling and experiencing, and she asked if she could have a look, and well, I felt she dismissed it and just said that it looked like a rash or a scar. I kept voicing my feelings because I felt like something was wrong. I knew that it was not a rash. I have had rashes and this was not a rash. It felt nothing like a rash. Although like I've never had any medical training, I still knew, like I instinctively knew that this shouldn't have been happening. No one spoke to me at that hospital about it at all. I got sent home. I don't even think I had any pain relief at all. I was just in this air-conditioned room 24/7 pretty much, and my girls were holding a fan over my wound because it was burning. It felt like my backside was on fire. Yeah, just constant pain. I hated having a shower. The feeling of the water actually touching my wound, it was horrific, and I would just sob, and the girls could hear me sobbing. It wasn't until maybe a day or two later my mum was able to get me in to see her GP, and I was just sobbing, just waiting in the surgery to see the doctor. It's like, how many more people are in front of me? Because I felt like I was going to die from like the level of pain. Like I can't even put it into words what that felt like, but it was just this constant throbbing and aching. And the triplets were 13 going on 14. They were giving me wound changes in between the community health nurses coming, and just for comfort wise, and also to soak up discharge that was coming from the actual wound. And then when it wasn't my own kids that were helping me, it was my mum and my grandmother. Oh, they were embarrassed. I mean, who wants to see their mother's backside, you know, at the age of 13? I kept getting told that it would get better using the pseudocream. It was getting worse. It had like little blisters coming all over it and like little pockets of pus, basically. The pain medication wasn't working, wasn't even touching the sides, and I was really like baffled because I was on like quite strong pain medication, a lot of S8 drugs, and I didn't understand what was going on. I just thought the solution was I was doing what I was being told to do. My mum, you know, she would hear me crying and she'd end up crying because I was in so much pain, and yeah, it was not a fun time. It was nothing that I'd want to ever relive or see anyone else go through. We ended up going to a women's shelter because of the situation that we'd come from, as well as not having anywhere to live. I actually drove, and I learnt how to position myself on the seat. I had a special gel cushion, and that's how I would take the kids to school, and then I'd drive straight back over to my grandmother's house where my mum and dad lived, and I would wait for the nurse. And that was every second day. And in between, my daughters would take turns at the refuge with them, changing my wound. And luckily, we were the only family in that wing of the refuge. So we came out here, and I was just worried about the whole medication. You know, basically I was like, I know you don't know me, but here's a letter from the doctor. I'm on all these S8 drugs. Give me more. I just want more. I want to kill the pain. I don't care what it is. Just give it, you know, write me a script. Please, I'm begging you. You know, I've transferred my records. You know, you can check anything you want to check. I'm not a drug addict. I am like seriously and genuinely in pain, and I'm not dealing with it, and I need help. He asked to see my wound, and he just said, you need to go to the hospital right now. And I said, no, it's all right. Like, you know, I've been doing everything that I've been told to do. I just need more pain medication. It's all right. I honestly thought I was going to be in pain like that forever. Like, I didn't see an end to it. I thought my life had just completely changed, and that's how it was going to be. And I just have to live with it, and that was my life from then on. So I went to the hospital. My mum came with me. She drove me. I think that was the turning point where I felt people were taking me seriously, and they were like really shocked to see my wound and how serious it actually was. I didn't realise that it was as bad. I felt like it was downplayed a lot. I lost count of the amount of debridements that I had. I wouldn't even be able to tell you how many I actually had, but it was a lot. Like, I'd say up to 10 within that 4-month period. When I saw the photo after the first debridement, the surgeon, he didn't want to show me. And I thought, well, that's weird. Like, it's mine. It's on my body. Like, I want to see it. And he said it's pretty gory. Like, you know, do you have a strong stomach? I just cried. He sent it to my phone, and I opened it, and I just cried. It was really deceiving. The amount of damage that was actually under the skin, it wasn't like this. After the first debridement, it was like this. And it took up pretty much my whole rump. And it was like a cave. I also developed MRSA, and I was put into isolation. Spent a lot of time on my own, just waiting for someone to come and visit me and take my mind off the pain. I still could not sit. My mental health suffered. Most of the time I had no contact with anyone other than the actual nurses that were coming in. Every couple of days I would have a vac wound change, because after each debridement they would put a whole new dressing on, and yeah, and that was a huge process as well. I would literally scream. I could not hold it in. I did try to do things while they were doing the wound change by shopping for wool, because I really like to crochet, and that kept my mind off it. I can't even begin to describe like the places that your mind can take you, like when you are isolated. I was still lucky that I had my mum coming in to see me every second day. My mum has her own issues with her health. It got to the point where they didn't want to come in and see me much anymore. Like, it just felt like it was never ending. So my wound began to heal while I was in hospital through the help of the vac machine. Then I was scheduled to have a Y-flap procedure done, where he took the skin from my thighs and moved it up to cover the wound and sewed up on my thighs. I had to lie still for 7 days. I could not have a shower. I couldn't get up to go to the toilet. I had to rotate from my stomach to each side every at least hour or two. I then developed a small hole, which I then developed osteomyelitis in that hole. It ate away at my tailbone. I am missing part of my tailbone from the infection. I was admitted back into hospital a few times and given a PICC line, and then I was being seen by hospital in the home team, where they would come early in the mornings and give me my different antibiotics through the drip line and through the little Baxter pump, and I would have to carry that around with me, as well as the vac. I was on antibiotics for a long time, 3 months I think, after being discharged from hospital. Then I was on oral antibiotics after that as well, for a bit longer too. My backside is still tender. I can feel pressure, but I can't tell what it is. Like, for instance, I can't have the heater in my car, the seats, because I can't tell when it's getting too hot. The wound is healed. I still have a deformed backside. Life, I think it's pretty good. I am going to TAFE again. I've had to consider a different career path just because of the numbness in around the wound. I can't afford to get kicked or hit or anything in that area because it could open at any time. I still have a pressure mattress. I still have to sit on my Roho cushion. It hurts when I get up. I can't sit or lie for too long. I have to be really mindful about where I sit, what I sit on, how long I sit. Make sure there's nothing under me when I sit, because I don't know. I can't feel it, and it could be causing more damage. So my advice to give to staff would be to actually listen to someone that's voicing their concerns and not to dismiss them. Pay attention and document what you've done. Treat people like human beings, because we are. No one's better than anyone else. You know, just because I haven't been to university doesn't mean that I'm not intelligent. It's my advice to someone that was going into hospital, and I quite frequently give this: have at least a bit of the knowledge about how it could impact you, because it's not a 5-minute ordeal. This took years away from me and my kids. If you've got the means, you're better off to turn yourself or annoy them to get them to turn you. Don't let that go. Yeah, I definitely feel like I'm in a better place now, and I'm getting out there and meeting new people and experiencing new things. So I'm yeah, in a good place right now.